helping you take control to live life with a new perspective. Living your best life every day. Intentional Living with KLBK's Terry Furman. Sponsored by Urban Tea Company and KK's Corner Mall.
Doctors and nurses never shy away from helping those in need, even when it puts their own health at risk. But during this time of the coronavirus pandemic, it's their own mental health that could be suffering. That's this week's Intentional Living, and thank you to all of our frontline workers. Being a healthcare provider is always high risk and full of stress. But experts are saying because of the coronavirus, those risk factors and stressors are amplified. Our healthcare workers are becoming the so-called second victims of this crisis. That term refers to those experiencing trauma related to a patient's care.
You're talking about a vulnerable population of people. I mean, death by suicide among the medical community is higher than the general population, and within EMTs and emergency workers, it's the highest even among medical workers. So, there's a lot of stress.
Hospitals around the country have been running at or over capacity. Work hours have increased, supplies and protective gear have been in short supply or at times non-existent. And yet healthcare workers are expected to give each and every patient 110%. And because of how contagious the disease is, patients often aren't allowed to have contact with their loved ones, putting their doctors and nurses in the position of comforter as well. Many in the healthcare industry have also decided to distance themselves from their family members to keep them safe.
Significant psychological toll of that as well, not just for themselves in terms of am I safe? Did I contract the virus? Was I just exposed? And then going home, potentially exposing it to others.
Which is why now more than ever, they need our support.